Question 1. A pediatric nurse is assessing 4 patients in the emergency department. Which patient should be prioritized for immediate care? A. A 6-year-old with a fever of 100.4 degrees Fahrenheit and mild cough. B. A 2-year-old with a heart rate of 180 BPM and lethargy. C. A 10-year-old with a minor laceration on the arm. D. A 4-year-old with a rash and no other symptoms. Answer. A 2-year-old with a heart rate of 180 BPM and lethargy. Rationale. A heart rate of 180 BPM and lethargy in a 2-year-old indicate potential cardiovascular or respiratory distress, requiring immediate intervention to ensure patient safety. Question 2. A nurse is delegating tasks in a busy pediatric unit. Which task is appropriate to delegate to a licensed practical nurse, LPN? A. Administering IV antibiotics to a neonate. B. Performing a developmental assessment on a toddler. C. Taking vital signs on a stable 8-year-old. D. Developing a care plan for a child with diabetes. Answer. Taking vital signs on a stable 8-year-old. Rationale. Taking vital signs on a stable patient is within the LPN scope of practice, while the other tasks require advanced assessment or planning skills reserved for registered nurses. Question 3. A 5-year-old with asthma is experiencing respiratory distress. Which intervention should the nurse prioritize? A. Administering a bronchodilator via nebulizer. B. Providing oxygen via nasal cannula. C. Starting in 4-line for fluids. D. Teaching the family about asthma triggers. Answer. Administering a bronchodilator via nebulizer. Rationale. Administering a bronchodilator is the priority to relieve acute respiratory distress in asthma, addressing the immediate airway obstruction. Question 4. A nurse is caring for a 3-year-old with suspected dehydration. Which assessment finding requires immediate action? A. Dry mucous membranes. B. Sunken fontanelle. C. Decreased urine output. D. Mild irritability. Answer. Sunken fontanelle. Rationale. A sunken fontanelle in a 3-year-old is a critical sign of severe dehydration, indicating the need for urgent fluid resuscitation. Question 5. Which task can a pediatric nurse appropriately delegate to an unlicensed assistive personnel UAP? A. Monitoring a child's oxygen saturation. B. Assisting a 7-year-old with ambulation. C. Administering oral medications. D. Evaluating a child's pain level. Answer. Assisting a 7-year-old with ambulation. Rationale. Assisting with ambulation is within the UAP's scope, while the other tasks involve assessment or medication administration, which require a licensed nurse. Question 6. A 10-year-old with type 1 diabetes has a blood glucose level of 350 mg per deciliter. What is the nurse's priority action? A. Administering insulin as ordered. B. Encouraging oral fluid intake. C. Checking urine for ketones. D. Notifying the physician. Answer. Administering insulin as ordered. Rationale. A blood glucose level of 350 mg per deciliter indicates hyperglycemia, and administering insulin is the priority to prevent complications like diabetic ketoacidosis. Question 7. A nurse is assigning tasks for a child with a tracheostomy. Which task is appropriate for a respiratory therapist? A. Changing the tracheostomy tube. B. Administering oral medications. C. Assessing the child's pain level. D. Providing family education on tracheostomy care. Answer. Changing the tracheostomy tube. Rationale. Changing a tracheostomy tube is within the respiratory therapist's expertise, while the other tasks are typically nursing responsibilities. Question 8. A 4-year-old is admitted with suspected meningitis. Which symptom requires immediate reporting to the physician? A. Fever of 101 degrees Fahrenheit. B. Nuchal rigidity. C. Mild headache. D. Irritability. Answer: nuchal rigidity. Rationale: nuchal rigidity is a hallmark sign of meningitis, indicating potential neurological involvement and requiring urgent medical evaluation. Question 9. A nurse is prioritizing care for a child post-tonsillectomy. Which finding is most concerning? A. Occasional swallowing. B. Refusal to drink fluids. C. Frequent swallowing. D. Mild throat pain. Answer: frequent swallowing. Rationale: frequent swallowing may indicate postoperative bleeding, a critical complication requiring immediate intervention. Question 10. A pediatric nurse is managing a child with a new diagnosis of epilepsy. Which teaching point is most critical? A. Avoiding sugary foods. B. Ensuring medication adherence. C. Limiting physical activity. D. Monitoring sleep patterns. Answer: ensuring medication adherence. Rationale: medication adherence is critical in epilepsy management to prevent seizures and ensure patient safety. Question 11. A 6-year-old with a fever is prescribed acetaminophen. Which action ensures safe administration? A. Confirming the child's weight. B. Checking the child's temperature. C. Reviewing the child's allergies. D. Assessing the child's pain level. Answer: confirming the child's weight. Rationale: acetaminophen dosing in pediatrics is weight-based to ensure safe and effective administration. Question 12. A nurse is caring for a neonate with jaundice. Which intervention is most appropriate? A. Increasing oral feedings. B. Initiating phototherapy. C. Administering vitamin K. D. Monitoring blood glucose. Answer: initiating phototherapy. Rationale: phototherapy is the primary treatment for neonatal jaundice to reduce bilirubin levels and prevent complications. Question 13. A nurse is delegating care for a child with cystic fibrosis. Which task is appropriate for a physical therapist? A. Administering pancreatic enzymes. B. Performing chest physiotherapy. C. Monitoring respiratory status. D. Educating the family on nutrition. Answer: performing chest physiotherapy. Rationale: chest physiotherapy is within the physical therapist's scope to help clear mucus in cystic fibrosis patients. Question 14. A 9-year-old with a fracture is in a cast. Which finding requires immediate action? A. Mild itching under the cast. B. Numbness in the toes. C. Slight swelling at the cast edge. D. Mild discomfort when moving. Answer: numbness in the toes. Rationale: numbness indicates potential neurovascular compromise, a critical complication requiring immediate intervention. Question 15. A nurse is triaging a child with a head injury. Which symptom is most concerning? A. Mild headache. B. Vomiting twice. C. Drowsiness. D. Irritability. Answer: vomiting twice. Rationale: vomiting after a head injury may indicate increased intracranial pressure, requiring urgent evaluation to ensure patient safety. Question 16. A nurse is assigning tasks for a child with a central venous catheter. Which task is appropriate for an RN? A. Flushing the catheter with heparin. B. Assisting with hygiene care. C. Taking routine vital signs. D. Providing oral hydration. Answer: flushing the catheter with heparin. Rationale: flushing a central venous catheter requires specialized knowledge and is within the RN scope of practice. Question 17. A 7-year-old with sickle cell anemia is experiencing a pain crisis. What is the nurse's priority action? A. Administering 4 fluids. B. Providing oxygen therapy. C. Administering analgesics. D. Monitoring temperature. Answer: administering analgesics. Rationale: Pain management is the priority during a sickle cell crisis to ensure patient comfort and prevent further complications. Question 18. A nurse is caring for a child with suspected appendicitis. Which finding requires immediate action? A. Mild abdominal pain. B. Fever of 100.8 degrees Fahrenheit. C. Rebound tenderness. D. Decreased appetite. Answer. Rebound tenderness. Rationale. Rebound tenderness is a critical sign of appendicitis, indicating potential peritoneal irritation and requiring urgent surgical evaluation. Question 19. A nurse is prioritizing care for a child with a new tracheostomy. Which action is most critical? A. Suctioning the tracheostomy. B. Changing the tracheostomy ties. C. Monitoring skin integrity. D. Providing family education. Answer. Suctioning the tracheostomy. Rationale. Suctioning ensures airway patency, the highest priority for a child with a new tracheostomy to maintain respiratory function. Question 20. A 12-year-old with anaphylaxis receives epinephrine. Which follow-up action is most important? A. Monitoring respiratory status. B. Administering antihistamines. C. Providing oral fluids. D. Educating about allergen avoidance. Answer. Monitoring respiratory status. Rationale. Monitoring respiratory status is critical after epinephrine administration to ensure airway stability and prevent further anaphylactic complications. Question 21. A pediatric nurse is caring for a 7-year-old with suspected anaphylaxis. Which initial action is the priority? A. Administering oral antihistamines. B. Administering intramuscular epinephrine. C. Starting supplemental oxygen. D. Obtaining a detailed allergy history. Answer. Administering intramuscular epinephrine. Rationale. Intramuscular epinephrine is the first-line treatment for anaphylaxis to rapidly reverse life-threatening symptoms and ensure patient safety. Question 22. A nurse is delegating tasks for a child with a new insulin pump. Which task is appropriate for a certified diabetes educator? A. Adjusting the insulin pump settings. B. Monitoring the child's vital signs. C. Administering oral glucose. D. Changing the infusion site dressing. Answer. Adjusting the insulin pump settings. Rationale. Adjusting insulin pump settings requires specialized knowledge and is within the scope of a certified diabetes educator. Question 23. A 3-year-old with a burn injury is admitted. Which assessment finding requires immediate intervention? A. Pain at the burn site. B. Heart rate of 160 BPM. C. Mild edema around the burn. D. Refusal to eat. Answer. Heart rate of 160 BPM. Rationale. A heart rate of 160 BPM in a 3-year-old with burns may indicate hypovolemia or shock, requiring urgent intervention to stabilize the patient. Question 24. A nurse is prioritizing care for a neonate with respiratory distress syndrome. Which intervention is most critical? A. Administering surfactant therapy. B. Providing oral feedings. C. Monitoring blood glucose levels. D. Applying a warm blanket. Answer. Administering surfactant therapy. Rationale. Surfactant therapy is essential to improve lung compliance and oxygenation in neonates with respiratory distress syndrome. Question 25. A nurse is assigning tasks for a child with a ventricular shunt. Which task is appropriate for a registered nurse RN? A. Assisting with repositioning the child. B. Monitoring for signs of shunt malfunction. C. Providing oral hydration. D. Changing the bed linens. Answer. Monitoring for signs of shunt malfunction. Rationale. Monitoring for shunt malfunction requires advanced assessment skills and is within the RN scope of practice. Question 26. A 5-year-old with leukemia is experiencing febrile neutropenia. What is the nurse's priority action? A. Administering antipyretics. B. Initiating broad-spectrum antibiotics. C. Encouraging oral fluid intake. D. Monitoring respiratory rate. Answer. Initiating broad-spectrum antibiotics. Rationale. Febrile neutropenia is a medical emergency, and prompt administration of antibiotics is critical to prevent sepsis. Question 27. A nurse is delegating care for a child with a spinal cord injury. Which task is appropriate for an occupational therapist? A. Assessing neurological status. B. Teaching adaptive techniques for daily activities. C. Administering pain medication. D. Monitoring bladder function. Answer. Teaching adaptive techniques for daily activities. Rationale. Teaching adaptive techniques is within the occupational therapist's scope to promote independence in patients with spinal cord injuries. Question 28. A 6-year-old with a seizure disorder is actively seizing. Which medication should the nurse administer first? A. Phenytoin IV. B. Lorazepam IV. C. Levetiracetam PO. D. Valproic acid PO. Answer. Lorazepam IV. Rationale. Lorazepam IV is the first-line treatment for active seizures to rapidly stop the seizure activity and ensure patient safety. Question 29. A nurse is caring for a 9-year-old with a suspected foreign body aspiration. Which symptom is most concerning? A. Mild cough. B. Stridor. C. Sore throat. D. Low-grade fever. Answer. Stridor. Rationale. Stridor indicates airway obstruction, a life-threatening emergency requiring immediate intervention in suspected foreign body aspiration. Question 30. A 2-year-old is admitted with croup. Which intervention should the nurse prioritize? A. Administering racemic epinephrine via nebulizer. B. Providing warm fluids. C. Monitoring heart rate. D. Teaching about home humidifiers. Answer. Administering racemic epinephrine via nebulizer. Rationale. Racemic epinephrine is the priority treatment for croup to reduce airway swelling and improve breathing. Question 31. A nurse is delegating tasks for a child with a feeding tube. Which task is appropriate for a speech therapist? A. Flushing the feeding tube. B. Assessing swallowing function. C. Administering tube feedings. D. Monitoring for tube dislodgement. Answer. Assessing swallowing function. Rationale. Assessing swallowing function is within the speech therapist's expertise to ensure safe feeding practices. Question 32. A 4-year-old with a history of asthma is wheezing. Which assessment finding indicates a worsening condition? A. Respiratory rate of 24 breaths/min B. Use of accessory muscles. C. Oxygen saturation of 95%. D. Mild agitation. Answer. Use of accessory muscles. Rationale. Use of accessory muscles indicates increased work of breathing, signaling a worsening asthma exacerbation requiring urgent intervention. Question 33. A nurse is prioritizing care for a child with a new diagnosis of Kawasaki disease. Which intervention is most important? A. Administering IV immunoglobulin. B. Monitoring for dehydration. C. Providing antipyretics. D. Teaching about long-term care. Answer. Administering IV immunoglobulin. Rationale. IV immunoglobulin is the primary treatment for Kawasaki disease to reduce inflammation and prevent coronary artery complications. Question 34. A 10-year-old with a head injury is being monitored. Which finding requires immediate reporting to the physician? A. Mild headache. B. Unequal pupil size. C. Slight nausea. D. Irritability. Answer. Unequal pupil size. Rationale. Unequal pupil size may indicate increased intracranial pressure or neurological deterioration, requiring urgent medical evaluation. Question 35. A nurse is assigning tasks for a child with congenital heart disease. Which task is appropriate for a cardiology technician? A. Performing an echocardiogram. B. Administering diuretics. C. Assessing heart sounds. D. Providing family education. Answer. Performing an echocardiogram. Rationale. Performing an echocardiogram is within the cardiology technician's scope to assist in diagnosing cardiac conditions. Question 36. A 1-year-old with gastroenteritis is dehydrated. Which finding indicates the need for immediate fluid administration? A. Dry lips. B. Capillary refill of 4 seconds. C. Mild fussiness. D. Decreased tear production. Answer. Capillary refill of 4 seconds. Rationale. A capillary refill time of 4 seconds indicates severe dehydration, necessitating immediate fluid resuscitation to restore circulation. Question 37. A nurse is caring for a child post-appendectomy. Which complication should the nurse monitor for most closely? A. Mild incisional pain. B. Fever and abdominal distension. C. Refusal to eat. D. Mild nausea. Answer. Fever and abdominal distension. Rationale. Fever and abdominal distension may indicate a postoperative infection or perforation, requiring immediate intervention. Question 38. A nurse is delegating care for a child with juvenile idiopathic arthritis. Which task is appropriate for a physical therapist? A. Administering anti-inflammatory medications. B. Developing a joint mobility exercise plan. C. Monitoring for medication side effects. D. Educating about dietary restrictions. Answer. Developing a joint mobility exercise plan. Rationale. Developing an exercise plan to maintain joint mobility is within the physical therapist's scope for managing arthritis. Question 39. A 8-year-old with a history of cystic fibrosis is admitted with a pulmonary exacerbation. Which intervention should the nurse prioritize? A. Administering IV antibiotics. B. Providing nutritional supplements. C. Monitoring oxygen saturation. D. Teaching about airway clearance. Answer. Administering IV antibiotics. Rationale. IV antibiotics are the priority to treat the pulmonary infection and prevent further respiratory compromise in cystic fibrosis. Question 40. A nurse is triaging a child with a suspected concussion. Which symptom requires immediate medical evaluation? A. Mild headache. B. Confusion and disorientation. C. Slight dizziness. D. Fatigue. Answer. Confusion and disorientation. Rationale. Confusion and disorientation are signs of a potentially severe concussion, requiring urgent evaluation to prevent neurological complications. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.